If you have breast implants but no longer wish to have them, you can easily remove them and you don't have to replace them. There are several reasons to remove breast implants, such as being too big for the body, or being old and needing to come out, or capsular contracture, which is a condition where one or both breasts become uneven or feel hard to the touch. Other condition may be a scar tissue buildup or autoimmune reaction to the scar tissue. Many times the doctor will recommend the removal of the implants using the en-bloc approach, which is removal of the whole capsule along with the scar tissue at the same time. This is called a capsulectomy, and it will completely remove any elements of contamination and bacteria that can trigger an autoimmune reaction. Many times autoimmune reactions can show up as hair loss, weight loss, and chronic fatigue, among other symptoms. So basic lab tests and a complete checkup with your primary care doctor is recommended to see if the breast implants could be causing the problem. The breast implant removal itself is a fairly straightforward procedure and can involve simply removing the implants, or if your plastic surgeon advises, perhaps a breast lift may also be recommended to restore the proper shape. During implant removal, many patients choose to have fat taken from different parts of the body and transferred to the breast. And this is a good idea to fill and rejuvenate the breast to give them volume. Now I am going to start with the recovery tips after a breast implant removal surgery. Tip number 1. Sometimes the plastic surgeon will leave a drain after the procedure. It is totally normal, and the drain will typically stay with you for a maximum of 8 days. Tip number 2. Some plastic surgeons will recommend that you wear a breast compression band. It is to avoid swelling and also to avoid the formation of fluids and seroma in the breast area. These situations are something to be aware of, and although the band may be a little uncomfortable, it is needed for as long as the plastic surgeon recommends for proper healing of the breast. Tip number 3. Do not exercise or lift things up for 2 months after the surgery. Even if you feel 100% recovered before that, it is best to wait and avoid anything strenuous until the 2 months have passed. Also, wear the breast garment for the same amount of time and check with your doctor to see if you are well healed. Tip number 4. At the beginning, the surgery scar will be pink, but depending on your skin condition, it should start turning into your natural skin color anywhere from 2 to 6 months after the surgery. So, be patient with the healing process of the scar. Tip number 5. This tip goes for before and after the breast surgery. Follow your doctor's advice to do as many chest exercises as you wish to tone up the muscles in the breast area, as this will help get better results from the surgery. And those were the 5 recovery tips I had for you. For the best doctors and lowest prices in Costa Rica for breast surgery, click on the links in the YouTube description below. I also invite you to continue watching my next video where I talk about the recovery tips for tummy tuck and liposuction. I'll see you in my next video.